First contact practitioner and physiotherapist is quite a new role, and it's a big government initiative to promote the service all over England, and we've recently started the service in County Durham and Darlington.
So you have some pain in your shoulder. If we look at this model here, you can see that the shoulder joint is like a ball socket joint, like this.
So the main aim of the service is to kind of reduce pressure on GPs and ensure that patients see the right person, the right time at the right place. So it's estimated that 1 in 5 GP appointments are for musculoskeletal conditions. So first contact practitioner is there to see patients as a first line treatment who are presenting to the GP surgery with musculoskeletal conditions such as joint aches and pains, muscular injuries, sciatica and osteoarthritis.
So generally speaking, you as a patient would ring your own GP practice. As you would on the phone, you would say, I have a poorly knee or a pain wherever. And if it's deemed to be a musculoskeletal problem, or there's a query that it's a musculoskeletal problem, and that means things like joint pain and stiffness, osteoarthritis, sciatica, there's a huge list. Anything like that that's new, ideally it should be a new problem that we deal with because our first contact nature is the first line. You would ring reception. Reception would then offer you an appointment with a first contact physiotherapist, usually on the day. So you'd ring on the morning as you would anyway. You'd then have a telephone consultation in the first instance, and then we can always arrange a face-to-face. Again, that's usually on the same day, but it will be within at least 2 working days. So it's a fast service, and it's designed then for us to assess, diagnose, manage, give advice about lifestyle, work, and sometimes kind of squash things before they then develop into chronic problems or more complications or what have you.
And then bringing your arms up forwards. Good, and then back down again.
When you come and see us or over the phone, we would give you a lot of advice. A big part of what we do is helping you, so educating you as a patient to self-manage the condition, the problem, whatever, in a bit more of a global way. And also a benefit, I guess, of coming to see a first contact physio is that you would have more time with us than perhaps you might with a GP. So it's great then that we have time to listen and we have time to manage things in our way.
Good, elbows into your side, and again just pushing out. Obviously the GPs are kind of really talented and very knowledgeable in like a wide array of problems that the patients might present to them, where us as physiotherapists in this role, our expert knowledge is specifically within musculoskeletal conditions. So whereas say if a GP might see someone with a muscle or joint problem and then signpost them to physiotherapy, we can give them that expert assessment from the first contact that we have with the patient and give them advice on initial management and get them started with some exercise and activity from the first time that we speak to them.
Our job is to inform and educate and show you the right things to do, and then your job as a patient is to take that on board and go away and apply that as best possible. Most of the time, the majority of the time, we can manage these problems independently.
Whether it's first line treatment, advice on self-management, on exercise and activity, or do investigations like x-rays and MRI scans.
Some first contact physios have the ability to prescribe and give out steroid injections into joints, which is a great bit of kind of independence for us to do, and again not have to get involved with the medical side of the team or the GP, and we can manage those things, and that's something that's not offered in every practice, so it's great that we're doing that.
So when patients contact us for new musculoskeletal problems, and there is actually an alternative that can help them just as good, maybe even better, because they're clearly specialists in their own field. Yeah, any little bit helps with the GP workload.
And relax, and then if you raise up against my hand.
Some patients clearly want only to see the doctor, and it's only the doctor that can help me. We know that that's not true, because we know that the first contact physios, they do fantastic work. So usually when the patients have been in contact with them for the first time or second time, they're really happy with the service, and they're happy to be contacted again if it needs to be done again. So the experience has only been good. Yeah, I don't think I've had any complaints so far.
Generally speaking, we want to see people who have a new problem, whether that's come on from an injury or it's just came on randomly, you know, aches and pains, and a lot of it we can give reassurance for, and that's why we're there, and it takes away from the GP, which is perfect in terms of kind of future-proofing things.